Thank you for joining today's telephone town hall with Congressman Tom Tiffany. During the call, Congressman Tiffany will be taking questions from participants like you. If you would like to ask a question, please press star 3 at any time. Again, if you would like to ask Congressman Tom Tiffany a question during this live telephone town hall, please press star 3. With that, I will turn it over to Congressman Tom Tiffany.
Well, thank you, Brittany, for setting up this healthcare town hall tonight. And that is exactly what we want to talk about tonight is healthcare. Really looking forward to it. And there really is some good news here in America and in Wisconsin. There's 52 million tests that have, COVID tests that have been done here in our country, and we're on our way to 100 million by September. The federal government really has mobilized here, as well as private businesses in our states, to control the spread of COVID. Infection rate here in our country is lower than most countries, and with a massive mobilization of personal protective equipment, what I'm hearing in the district is that most healthcare facilities are in good shape. I know I talked to a dialysis center earlier today, and they feel at this point that they're in a good place, as well as some of the hospitals that I've been talking to. The really exciting stuff, and I think the good news, is that you're seeing therapies that are coming forward that are being produced. For example, remdesivir has proven to be successful for some people. Those therapies are being created and moved forward by the Food and Drug Administration, as well as vaccines. Now we have 3 companies that are in stage 3. And they've gotten to stage 3 with these vaccines in 4 months. Compare that to Ebola. Ebola, the vaccine for that, it took 13 months for it to get to stage 3. And the administration has really done a good job of sweeping away some of those unnecessary bureaucratic impediments while making sure that they're doing it safely. And we are now at stage 3 with 3 companies to create a vaccine. And hopefully that research will continue to progress here as we go forward. So here in the 7th Congressional District, a couple of statistics that I'd throw at you. There's currently 33 patients that are actively hospitalized for COVID. That is as of yesterday, July 30th. And there's 366 ventilators readily available in the district. 44 are currently in use. Every county, there's 26 counties that are in the 7th Congressional District. Every one of them is in single digits for the number of deaths from COVID. And of course, we don't want there to be any, but those numbers really have been kept in check up in our region. Currently, there's 6 community testing sites in the district, and there's another one that's going to be added in Wood County by the end of this week. One other thing that I'm going to mention here before I introduce my guest that I have along for the ride tonight is in regards to the telehealth expansion. And CMS, the federal agency, has waived restrictions on telehealth services to ensure that healthcare professionals are eligible to bill Medicare for that. And that really strikes a chord for me. Having sat on our finance committee in the state legislature, we fought for years to be able to get compensation for our healthcare providers for telehealth services. And thanks to this administration, they listened now and they said, we are going to compensate those people seeking Medicare reimbursement for those telehealth services, which are now so important here as we go forward, with many people choosing not to go into their healthcare facility if possible, if they're able to get their needs taken care of at home. So anyhow, with that, before we start taking some questions, I have Dr. Greg Murphy with me tonight. Dr. Murphy is a congressman from North Carolina's 3rd District, and he covers a largely rural district, not unlike the district that I'm in here in the 7th Congressional. After completing his residency in urology and renal transplantation at the University of Kentucky, Dr. Murphy settled in Greenville, North Carolina, where he opened his own practice. And his surgical practice has a 1,000-bed level 1 trauma center serving 29 counties in eastern North Carolina. Following a transition from medicine to public policy, he's been in the state legislature, not unlike me, and now has recently come into the United States Congress. And during his second term in the legislature, he served both as the chair of he was the senior chair of health policy and the chair of health and human services appropriations. In 2019, he beat out 16 other Republicans. I thought I had it tough with having one other or two other people that were in the race. He beat out 16 others in a special election to be able to serve here in Congress. I serve on science, space, and technology, as does Dr. Murphy. And so I just want to welcome Dr. Murphy. If you want to take a second and say hi.
Thank you so much, Tom. Thanks, guys. I'm happy to answer any questions and help Congressman Tiffany out at all I can. I can tell you just in the short time he's been here, he's gained the respect and the admiration of a lot of folks up here. Your congressman and I went out to a trip actually down at the border, and we were talking with a lot of border agents, and it was really a big pleasure of mine to get to know him, and I'm happy to answer any questions you guys have from a medical standpoint. But y'all picked the right man, and I appreciate y'all supporting him.
Yeah, and before we take our first question, I want to dovetail on that trip to the border. That really was an eye-opening experience, wasn't it, Greg, to go down there and visit the border?
Yeah, it really was. And guys, there's all this clamor about a border wall and all the emotions that go with it. But you talk with the border agents that are down there. We need a physical structure that goes along with the other technologies that we need. We're talking about drug trafficking. We're talking about human trafficking. It's not just illegal immigration. It's so much that comes over our border that hurts the people of this country. So it was a great visit and a very eye-opening one for both of us.
Yeah, one thing that dovetails into what we're talking about tonight in regards to health care that we found out when we were down there, illegal immigration down at the border kind of paused for a little while when this hit, because they were very concerned also about how serious this was going to be with COVID-19. Well, now that has picked up, and we are seeing part of the reason why you're seeing this big uptick in Arizona is you've seen an increase in illegal immigration, and that is feeding into some of the increased numbers down in Arizona. So anyhow, with that, why don't we take our first question, Brittany?
Wonderful. Well, again, if you have a question, just press *3 on your phone's keypad, and we will get you into the queue. Our first question is going to come from Marion. Marion has a question about school reopenings. Marion, you are live with the Congressman.
Thank you. Congressman, I worked retail for a lot of years, and I kind of got out of it in July and that. But people that work retail are exposed to the COVID every single day. They're, how shoppers are and that. Why can't schools reopen? If people aren't getting sick working in grocery stores, then how can teachers get sick in the classroom? I think that's just, I don't understand that.
Yeah, I think this is one of the key questions as we go into fall, and I believe it's the biggest public policy question that we have before us, is the reopening of schools. And I've introduced a bill to encourage and to incentivize schools to reopen. The data is very clear. There is no one in the state of Wisconsin, 19 years of age and younger, that has died from COVID-19. In fact, when we look at the data that's coming from the CDC, Dr. Redfield has cited how there are more deaths on average from the flu than we see with COVID-19. And we're seeing really great impacts on our kids. So I think about it. I've got a daughter that's in high school. I saw those final 3 months of school, and there just was not as much learning that happened during that period of time. And we cannot allow that to continue to happen, because otherwise we're going to lose a generation here. And so I think it's really important to get kids back to school. And the schools in my immediate area, my kids go to the Lakeland School District up in Minocqua. They're planning on opening 5 days a week, and they think they can do it safely and responsibly. They're going to offer a virtual option. I think that's important. If there's parents and children that think it's better for them, better for their safety, that they use the virtual option, I think most schools are going to include that to be able to respect their wishes. And I think that's really a good thing. But what I'm hearing is it's probably an 80% issue in people that I've been talking to, that they want their kids back in school here And I believe we can do it safely. I think we can do it responsibly. But I just think it's so important because we do not want to lose this generation, especially with the uptick that we're seeing in drug and alcohol abuse. And we're hearing anecdotal stories about suicide rates are up. Let's make sure the cure is not worse than the disease. I don't know, Dr. Murphy, you have anything to add?
Yeah, no, I thought that was a great summary. I will tell you, I mean, to your specific point, the way I've addressed this in North Carolina is I believe education is essential. I believe our teachers are essential workers, and they should come back. You know, there's been a lot of fear mongering. Some of our folks are, are an older age group, but I mean, I've advocated you're going to be 15 feet away from the children, wear a face mask rather than a face shield rather than a mask, so that you can be seen and you can be heard. But I believe that our teachers are essential workers. I believe education is an essential activity, and I think our kids need to go back to school.
And by the way, most of the teachers I talk to up in our area, they want to go back to school also. They want to get in the classroom and to be able to teach kids. I mean, we see some of the stories coming from the big unions in Los Angeles and New York, places like that. I don't think they represent the teacher's mentality, especially up in our region. Those teachers want to get back in school as much as the kids do and be able to advance their learning. That's what they were trained to do, and that has been their career path, and I think they really want to follow through with that also. So anyhow, thank you for that question.
Wonderful. And again, if you have a question, please press *3 and we'll get you into the queue. Our next caller is Sarah from Marshfield, and Sarah has a question about mask wearing. Sarah, you are live with the Congressman. Sarah, do we have you on the line? Looks like we might have lost Sarah. Well, before we go on to our next question, we do have a few poll questions for the audience tonight. In order to gauge the opinions of those in the audience, we wanted to be able to share some results at the end of this event regarding the polls. So here's our first poll question. Given that there have been 0 recorded transmissions of COVID from student to teacher, do you feel that schools should reopen in the fall? Press 1 for yes, or press 2 for no. Again, if you believe schools should reopen, please press 1. If you believe schools should not reopen, please press 2. Thank you so much, and we'll be sharing those results shortly. For now, let's go to our next caller. We have Mr. Carey from Eagle River. Mr. Carey, you are on the line with the Congressman.
We just wanted to thank him more so for what he's doing and looking out for the Northwoods. It's important that we have our own voice. Thank you.
No, thank you very much. This is a great privilege to be able to serve representing over 700,000 people from northern and western Wisconsin that I take very seriously. And these are big decisions that we're making here as we go through what is a difficult time here in our country with the unrest that's going on, especially in our big cities, and mix in a pandemic with that. All that stuff makes it a really challenging time, but I'm out here gathering as much information as possible, and that's why we wanted to have this healthcare town hall tonight. First of all, to make sure that we're sharing information with all of you that there is good news out there on this front of getting our country through this pandemic, and but then also hearing from you what's on your mind.
Wonderful. Well, thank you so much. And again, if you have a question, just press *3 and we'll get you into the queue. About the mask mandate. Al, you are on the line with the Congressman.
Hello?
Yeah, go ahead, Al.
Okay. Well, this whole, I call it a scamdemic, and it's all about compliance, control, undermine the churches, resurrect the government, and this Tony Earl needs to be gone. The information, I mean, these hospitals, a lot of them are registering motorcycle accidents, people dying from cancer as COVID because they get extra money. And I think if they throw the dead guy off the motorcycle on a ventilator, they get more money. and there's more people die from flus. And Tony Earl's trying to force people now to have to wear masks in public places. I have respiratory problems, and it's hard breathing when it's hot and humid. You throw a mask on, and it's even harder to breathe. I'm trying to earn a living, but I also have to go grocery shopping and things like that. These face masks as a whole are maybe 2% effective, and the homemade ones are probably even less effective. And you're not to mention, then you're breathing in what you're actually were created to expel. You're done breathing it in, and it's, from what I understand, starting to create a strain of Legionnaire's disease. And this meatball we got for a governor needs to go bye-bye.
Well, how about if Al, how about if I address your question in regards to the mandate for masks? So, first of all, so this just came out today. I haven't had a chance to study it thoroughly, but my understanding is that if someone does not wear a mask, you do not have to have proof that you do not need a mask. Now, I will say this. With private businesses, if they require a mask, and many do, I think that's their right to be able to do that. If they're going to require that, they think that's important for their customers' protection. I think they should be allowed to do that. I know I always comply with those private businesses that say, hey, you got to have a mask to come in the door. But I got to say that I do trust my friends and neighbors through this whole thing, and that if they believe they need to wear a mask, they should certainly do it. If they're comfortable not doing that, I think that's acceptable also. But, you know, one of the big public policy questions we're dealing with out here is liability reform. And over in the Senate Leader McConnell, he has really been trying to, they have that in their fourth package that they're putting forth now, that they're trying to craft, to have liability protections put in place. And I've been hearing that from not just private businesses, but also from schools and other public institutions. They think it's so important to have these liability protections put in place. Now, Speaker Pelosi has been holding this up. She does not want to put together some common sense reforms in regards to liability protections, and that's one of the things that's holding up this fourth coronavirus package from being advanced here in Congress. And it's really unfortunate because there is so much uncertainty at this point. You know, you think about this, just hit 4 months ago. There's a lot of things that we don't know at this point. Business owners and others, schools, they're making decisions on the fly. They're doing the best job they can with the information they have. It would be really unfortunate if we get a year from now and it turns out perhaps they made a decision that wasn't perfect, that wasn't quite right, and then they get sued. In hindsight, it's really easy to do something like that in hindsight, and that's why those liability reforms, liability protections are so important. And Dr. Murphy, I suspect you know a little bit about liability in the profession you're in.
Yeah, thanks, Tom. I agree completely. We actually have, that's been kind of line drawn in the sand, is that unless there are liability protections for industries, I actually submitted one for our schools for them to go back to, so there's one less hurdle for our schools to not worry about that to come back. But I'll just go back to the mask issue. You know, unfortunately, that's become political, and I will tell you, as a physician, and I've said this for several months, I do believe that the data is very clear that it does prevent transmission. You know, for many, many years, when we had a patient that came in the office that was coughing and sneezing during flu season, we slapped a mask on. So, you know, I just hate that people are seeing it one way or the other. I pray that, you know, we get to a point very, very soon that we don't have to worry about wearing these. We don't have to worry about all these social spacing and stuff. But, you know, we're moving forward as best that we can to try to get back and really get back to our lives and return to normal.
Yeah, so I just have some information in regards to the mask executive order that came from Governor Evers. And there is a FAQ that the governor's office has put out, frequently asked questions, and they put it this way: I have a medical condition that prevents me from wearing a face covering. Do I need documentation to prove that I don't need to wear a face covering in public? The answer is no. You are not required to carry documentation to prove that you do not need to wear a face covering in public. So to Al's point, if you have a health condition, you do not have to carry proof on yourself that says you do not have to wear a face covering. I hope that clarifies that a little bit. I'll be looking at this more closely tonight after we get done voting, since this decision just came out this afternoon. Brittany, we're ready for another one.
Wonderful. Well, our next question is going to come from Brandon. Brandon has a question about how COVID-19 impacts younger folks. Brandon, you are on the line.
Thank you, Mr. Tiffany. First off, just real quick, I think it's outrageous. We were unrepresented for so long from the point where Mr. Duffy stepped down and you were sworn in. But after that, the data kind of clearly shows that if you're under 50, you're at very little risk on this. So I'm just wondering why we're imposing such strict regulations on the majority of the country when we now have enough data to, say who's at risk and we can take steps for them versus imposing things on everybody. I mean, like the kids in school, they're already at a disadvantage with cell phones and tablets and stuff at actually reading and understanding body language and facial expressions. So I'm just worried that, if I send my kids back and everybody's face is covered the whole time, it's just going to further stunt their, development of actually understanding how to interact as a person versus, someone who's 6 feet away and, you can't understand the normal human cues.
Yeah, thanks for the question, Brandon. And to your original point, I'm just trying to make up for lost time. Yeah, it took a while to get that special election done, especially after it was postponed once and pushed back a few months. But I can tell you, me and my staff, we got up and running immediately. It was the first thing on the agenda was to get a good staff hired, both here in Washington and in the district, and we were up and running within a couple weeks and taking constituents' questions and concerns and getting them taken care of. So those offices are up and running, and we're trying to make up for that lost time. I'm going to turn this over to Dr. Murphy, but one thing that I think is really important for those of us that are political representatives is to make sure that we're looking at what are others doing? What other information is out there? Because, sometimes we don't always make the right decision. Today I was reading some information about Sweden and how they're going about it. Sweden, which never put in place a mask mandate, they did not lock down their country at all, and they thought they could get there by getting to herd immunity. They were down, I believe as of today or yesterday, they had a day where there were 0 deaths in their country. 0. They've gotten down to very low numbers. And so it's really, I'm going to be taking a look at their example as well as other countries like Japan and others to see, who's doing this right, who's in this situation with this particular virus, who has handled this the best to have the least consequences, the least negative consequences to their society. It's going to be really interesting to see how that plays out as we go forward. The one thing that I do know is that we are really ramped up here in the United States to make sure that personal protective equipment is out there and that those healthcare facilities have that. Now, it would be nice if we also got those liability protections put in place. But Dr. Murphy, go ahead and share your thoughts.
Good thoughts. Hey, Brandon, so, I really think that you're spot on. If you are under age 50 and healthy, the risk of you succumbing to COVID-19, especially now with all what's going on as far as medical interventions, is minuscule. It's not 0, but, driving your car across the town, your risk is not 0. Unfortunately, this has become an entirely political issue, and I'm going to call it like it is. The media have taken this to the advantage of trying to push an agenda, trying to inflame public opinion, and trying to politicize this entire thing. And it has people scared to death. And in my opinion, in my medical opinion, I think it is wrong. We need to protect those that need protection, our older folks, or those with significant comorbid diseases. But we need to get our lives back. We need to get our lives back in order, and we could do it very, very well safely. But the media has inflamed things that it just makes it so hard to do.
You know, and Brandon, I would just add to that. You know, I understood Governor Evers' original order for the first couple of weeks. You know, you go back to the middle of March when this all hit, and then he said, boy, we really got to lock things down for a couple of weeks. And I think people were with him, and, you know, we needed to figure out where we were at. But shortly after that, I kept saying to people, including to the governor, that let's take a targeted approach here. Let's make sure, rather than just taking this broad brush approach, we began to know who was affected by this the most. It was the elderly. We could see that young people were not dying from this, especially those under the age of 20. And so I still believe this. Let's make sure we take a good targeted approach. By the way, if you take a look, I saw some interesting information today. When you compare Minnesota and Wisconsin, we have about the same population, a little over 5 million people. And back when our Supreme Court ruled in May that Wisconsin could open up, that it was time to end the lockdown in our state, there were people over in Minnesota that said, boy, watch all the people that are going to die in Wisconsin versus Minnesota. Well, guess what? There are about twice as many people that have perished from COVID-19 in Minnesota than Wisconsin. Just this blanket lockdown was not the best approach to take. And Minnesota, I believe, has the same problem they had out in New York, where they went and put these people with COVID-19 into nursing homes and these elderly residences, and they actually made the problem worse. So it's really important, I think, that we take a targeted, smart approach as we get more information. We should be able to do that as policymakers. And by the way, there's two pieces of data that I look at in the district when my staff shares the numbers with me. That's the number of people that are in intensive care and the number of people who have passed away from this. I think those are the two critical pieces of data when you look at the health of the region. So anyhow, with that, Brittany, go ahead.
Wonderful. Well, before we get to our next question, we actually have the results of our first poll question. 85% of people on the phone tonight said that they believe schools should reopen, while 15% said that they believe that schools should not reopen. With that, we'll go to our next question. We have Lloyd, who has a question about getting tougher on China. Lloyd, you are on the line.
Yeah, hello, Tom. China keeps on giving us things, low prices on manufactured goods, and they do us big favors manufacturing all of our pharmaceuticals for us, 90% of our pharmaceuticals. I think it's time for us to retract all this kind of stuff we've been doing, giving them stuff to work on. And, these people have been stealing from us for years in all the departments, even manufacturing. They're stealing all the secrets. And why can't we get tougher on these people? There's too many people in Washington that look the other way.
Yeah, Lloyd, thank you so much for the question, and it is a very good question, and I think it's one of the key issues as we go through 2020 is who is going to take on China, who's going to make sure that they're being responsible, because you're absolutely right. They do steal our intellectual property. It is anathema to how we go about our business protecting private property in the United States of America, and they don't do that in China. But let's focus this on healthcare. All of our high blood pressure medicine is made in China currently. Is that a good decision on the part of the United States? You look at a lot of the healthcare goods. In fact, there were some personal protective equipment that just went through our customs that had to be rejected because it was not safe to use. It was not up to our standards that came from China. I think there are some critical things in terms of our military, military goods. I think that we need to be very careful with that. But I think healthcare falls within that also. Pharmaceuticals and other things. We need to bring some of that back, at least some of it back, to the United States of America so we are not completely dependent on China. Yeah, go ahead.
Hey, Lloyd, Greg Murphy, let me throw in something with that also. I actually submitted a piece of legislation today. If you look at our colleges and universities, they have essentially become infiltrated by the Communist Party of China. And I say this not to condemn all of our folks from China that are in our country that are going to school, not by any means. But our academic universities understand that they are literally a cash cow because they pay full rate, sometimes even more, for tuition and fees for students. And so they know that they're a dependable person that can come in and write a check. Unfortunately, we've seen many instances where there has been espionage done by folks on our campuses against this country. I mean, heck, the chairman of the Department of Chemistry of Harvard University was arrested in February for academic espionage. There are a lot of folks that are really complicit with this. And so it is one way that they are stealing our technology, our medical experiments, and all our research. And so, they're literally stealing our country out from underneath us.
Yeah, and I would just add to that, Greg, that we have a China task force within the Republican conference here in the House of Representatives, led by Michael McCall. And I urge all of you to take a look at what he is putting out there at this point, because he is down in Texas, and you probably recently saw that we closed the China embassy in Houston because that was a hub for stealing intellectual property here in the United States. And so the Trump administration took the right approach on that, making sure that that doesn't happen anymore. And we are following this very closely, and we are emphasizing this issue. For the security of our country, there needs to be action taken. Go ahead with our next question. Are we going to do another poll question?
We can certainly do the next poll question. The next poll question is this. Do you agree there is no substitute for the social development that occurs in an in-person learning setting? Press 1 for yes or press 2 for no. Again, do you agree there is no substitute for the social development that occurs in an in-person learning setting? Press 1 if you agree, and press 2 if you disagree. With that, we will grab our next caller. We have Ryan, who has a question about unemployment benefits. Ryan, you are on the line.
Hey, yeah, guys, first time in my whole life of ever having to collect on unemployment, and I didn't get a dime when like half of the other employees that were alongside of me claimed the same exact day because the company I currently was working for decided we were not needed. We are truck drivers, and that company decided they didn't need their trucks. So I ended up being home for a month, kind of ended up depleting my savings, and the money that was the extra $600, of course, because of everything that happened, as unemployment benefits are never anywhere near what we make. So, I mean, I haven't seen a dime of that. Well, it could definitely come in handy to at least, if nothing else, replenish my savings account, number one. Number two, I have one real quick thing on the question on the masks, and that is, okay, you're wearing them everywhere. However, you think about it, truck drivers, if this thing was as serious as it was supposed to be, we're everywhere. Not to mention, they say this stuff lives on everything. And unless you have sanitizer and everything on you all the time, well, you walk into a truck stop, you're touching a shelf here, you're touching a shelf there, you're doing this and you're doing that. Well, needless to say, you'd be in this stuff all the time, and I guess I'm just not believing the numbers.
Yeah, so let me answer that unemployment compensation question. First of all, Wisconsin has had a terrible problem with people being able to get their unemployment. I was dealing with it right at the end of my Senate term prior to my election on May 12th. We were having numerous constituents calling saying they couldn't get their unemployment. Just a month prior to that, we in the legislature authorized Governor Evers to move as many people as he needed to to be able to deal with this pandemic and the offshoots of it. One of them is lots of people applied for unemployment, right, Ryan? And so you had a lot of people that applied for that, and there became a backlog. Well, that backlog is still there. It is so disappointing. We're still getting complaints in this office, though it's a state issue. We're getting all kinds of complaints yet in my federal office that people in the district are still not getting their unemployment. The Evers administration has to redouble their efforts here to make sure that people get their unemployment. And we've been just urging them to do that, and I know other legislators have been just pounding on the door saying, you got to get this done for these people. Some people, they may lose their homes. They're not able to buy groceries. I mean, it has really gotten bad for some people, and we've been emphasizing to the Evers administration, get all the people necessary, work around the clock, work weekends if necessary, to get people their unemployment checks, but it just seems to have fallen on deaf ears. And the other thing that I would say is that there is discussions out here right now. There's discussions right now about extending the unemployment, the additional unemployment. I don't think we should do it the same way we've been doing it in the past. So if you look at unemployment compensation in Wisconsin currently, you get about $9.25 an hour. It's almost $400 a week. With the enhanced unemployment from the federal government, that's another $600 a week. That comes to $15 an hour. So all told, someone would make $24.25 an hour, $24.25 an hour with this enhanced unemployment. It actually is an incentive not to work. I think most people want to work, and I could hear that with Ryan. They just want to be able to go back to work. But we should also make it so there's not a disincentive to go back to work. And Representative Murphy, I don't know if you have anything to add and what your experience has been in North Carolina.
I agree completely. I have had employer after employer say they can't get their people back to work because they're being paid more to stay at home. That's a non-starter for me on this issue because we need to get our country back to work, and we can do so very safely.
Yeah, absolutely. You know, I'd just give you another example with the numbers. If you were a couple that is unemployed with the enhanced unemployment, you could make the equivalent of $100,000 a year the way it's currently structured. There's a better way of doing it, and that is let's get people back to work, and that should be our ultimate goal. You look back to January and February when this economy was absolutely humming, best economy that we've had in years. I heard from so many people how good it was, both people working for a wage as well as business owners, and we need to get it back to that point, and the only way you can do it is if people are going back to work. So with that, Brittany, go ahead. Let's take another question.
Sounds good. Our next question comes from John, who has a question about police and violence. John, you are on the line.
Yes. Good afternoon. I'd like to know, number one, I don't agree with defunding police because they're not all bad apples. But I'd like to know, all these democratic cities are defunding them, and they're getting the riots, and they don't let federal troops in there. And the Republicans are pretty silent on this, except for President Trump. And plus, the COVID virus, now that Dr. Fauci says he recommends us wearing goggles or eyeglasses because the virus is that bad. And I don't believe the fake media. I don't know what to believe anymore.
Well, hey John, why don't we talk about defunding the police here a little bit? It gets a little bit off from the healthcare side of things, but I do not support defunding police. And there was a proposal out here to make changes to take away qualified immunity away from the police, doing that from the federal level. And I believe what is needed here is for local governments to take responsibility for their police departments. That's where the decisions should be made. Where was the failure through this whole thing? Whether it was in Madison or Minneapolis or these other cities, it was with local leaders. The failure was both in keeping the peace, but also in the case of George Floyd's death, that officer, that's the city of Minneapolis and their mayor, they need to deal with a bad cop when they have one. I've seen a few examples up in our region. It's not very common, but every now and then you get a bad actor, just like any other profession. And I've seen local officials make sure that they drum those people who are bad actors out of their departments. They know that they have to have integrity with their law enforcement. So those decisions should be made at the local level. But we're seeing our law enforcement people absolutely demoralized at this point, and you are seeing the results of it with cities across the country. Violent crime is skyrocketing. We have to show police and law enforcement the respect that they deserve and make sure that we're not tying their hands to be able to deal with these riots. And as far as weighing in on this, as you brought up, John, when they tore down those two monuments at the state capitol in Madison, I sounded off immediately the following morning, calling for Governor Evers to take action, as he should have prior to that, to prevent those monuments from being torn down, and to show that those rioters, they don't care who you are, whether you're Republican, Democrat, or anything else. They beat up a Democrat state senator in Madison in those riots. They tore down the statue of Hans Christian Heg, who died at Chickamauga in 1863, defending the Union and helping to end slavery. They tore that statue down, and they claimed to be in support of racial minorities. They clearly don't know what they're doing, and they're simply anarchists that are trying to upend society, and we cannot allow that to happen. Brittany, we have time for one more question, and then Dr. Murphy and I have to go vote. We have a vote upcoming here in just a couple minutes.
Sounds good. Well, we do have results back from our second poll question, and 87% of people agree that there is no substitute for the social development that occurs in an in-person learning setting. Unfortunately, I do believe actually votes got called a little bit earlier, and so we are going to have to wrap up. Congressman Tiffany, would you like to make any closing comments before we do that?
I want to thank everybody that joined us on this call tonight. Contact my office anytime if you have questions, comments, concerns, however we can help you. If you have a veterans issue, whatever, you have an issue with an agency of the federal government, you be sure to let us know. We have people in district and in Washington, D.C. that are ready to deal with your concerns. I want to thank Dr. Greg Murphy for joining us tonight. I really value his input, and he is a leader out here in Washington, D.C., and I look forward to working with him here as we go forward. I want you all to be safe and responsible in how you're dealing with this, but there's good news out there in regards to our federal government dealing with COVID-19, and we need to continue to work through this as one country. I believe we can do this, and then as we get to the other side, we're going to get America back up on her feet again. Thanks, everybody.